Okay, shall I hold this or? Okay. Hello, I'm Dr. Mitrelias. I'm from the University of Cambridge and the CEO and President of Cambridge BioMagnetics. Cambridge BioMagnetics is a spin-off company from the University of Cambridge, specifically from the Department of Physics, the Cavendish Laboratory at Cambridge. And we have been developing a platform technology and a highly disruptive technology, and we want to apply this for clinical diagnostics, specifically for multiplexed clinical diagnostics. And I can explain very briefly what I mean by multiplexed clinical diagnostics. The idea is that the physician, a doctor, or a nurse can take a small sample, a blood, for example, a biological sample, and then using a device which is essentially what we want to fabricate, a medical device. Using this device, the idea is to analyze the sample for the presence of many pathogens in a single test, in a single assay, as it is called. So this is why where the term multiplexing comes from. Doing many analyses for many pathogens in a single test, which obviously reduces a lot the time and the cost which is associated with all the tests. In addition to that, with our technology, we want to develop this device, which is essentially a miniaturized system. It's a very small. It will be in the form of a handheld device, a handheld reader, into which a sample can be inserted, and then all the tests can be done in a very short period of time, very rapidly, and with great specificity and sensitivity as well. And the innovative part of our technology is that we utilize systems based on magnetic materials. My background is from the physics department, and we've been working on this technology for several years now. Our expertise are in thin film magnetism, in developing magnetic materials, and that's why I mentioned at the beginning that the technology is disruptive, because we really want to bring into the healthcare system, and specifically in multiplex clinical diagnostics, we want to bring in the knowledge which has been accumulated in the magnetic storage industry, in the hard disk industry, for example, which is something quite unique. So what we are developing more specifically is, very briefly I will mention this because it's a little bit technical, we're developing magnetic microparticles, magnetic microtags, with which we can tag a large number of biomarkers. The biomarkers are specific for pathogens which can be present in a sample. And so all we are doing is tagging, essentially, with our micro-tagging technology. We provide a system with which to tag these small biomarkers which can then react with the sample in order to see whether the pathogens which are associated with these biomarkers are present in the sample or not. And the benefits of the technology that we are developing essentially are three main benefits. The first one is that because we can provide a very large number of unique codes, of unique magnetic barcodes, it's like having a hard disk system, a miniaturized hard disk system, where you can store a lot of information. So we can provide a very large number of codes, which means that we can screen a sample for a very large number of pathogens in a single test. And by very large, I mean even extending potentially to billions. Of course, for diagnostics, there is no need to go to such high numbers, but our technology is capable of providing this very large number of unique codes. Second benefit, the ability that we have to fabricate a miniaturized device. So essentially, we will have a microchip, and even more specifically, a magnetic microchip. We call this magnetic lab-on-a-chip device. And again, we can do that because we rely on technology which has been developed for many years, or some aspects of it have been developed for many years in the computer storage industry. And we can really fabricate this integrated microchip which can do the analysis for them of a biological sample. The third benefit is a little bit more difficult to explain, but very briefly I will say that because we use magnetic materials, we have the ability the magnetic materials have the ability not only to store information, but we can also write and rewrite information onto them, specifically onto our magnetic microtags. I cannot go into technical details because I think that will be a bit confusing, but it is sufficient probably to say that with our system, with our microtags, a physician, actually the ability to write information onto the tags at will, at the user's will, has basically two benefits. The first benefit is that we are able to fabricate a huge number, and by huge number I mean millions and millions of these magnetic microtags using well-developed techniques from the microelectronics industry. And all the tags are identical when they are fabricated. They are all identical and blank, so they do not carry any information. This means that the cost is much lower as compared, for example, to the situation where we would have to fabricate tags with codes pre-encoded, which are the competing techniques in multiplex clinical diagnostics. So we can prepare a very large number of tags. They're all identical, they're all blank, and then the user can select some tags, write information onto them, attach the biomarkers, and then do the bioassay. This is a very unique ability which literally only our technology can offer because we use magnetic materials. So these are the three main key benefits of what we are doing. The technology is still under development. We set up the company a couple of years ago to commercialize and exploit commercially this technology. We are still in the process of, and in parallel, of course, research goes on in the university, at the university lab, at the Cavendish. We have quite a large group there. The head of the group is Dr. Crispin Barnes, we are now fundraising so that we can attract funds into the company in order to be able to commercialize this platform and disruptive technology. And I'll just finish by saying that what I mean by platform technology is that the technology has applications in a wide range of bioassays, in a very wide range. That's why it's a platform technology. So we can provide the tools with which a physician will really be able to carry out a very large number of very diverse assays. For example, screen for flu viruses, cancer pathogens, possibly, many other diseases where multiplexing is of benefit. It would be interesting to screen a sample for a large number of pathogens. So that's what we are doing at Cambridge. It is very exciting, yes, it is very exciting. And yes, we have, I think it's quite a unique technology. There are still several challenges, not that difficult in terms of scientific challenges, because we have solved most of the issues which are related